What does management of PCOS or PMOS look like within a functional medicine clinic? Now, the approach in a functional medicine clinic would be quite different to the approach that you would get within conventional medicine, just because for one, we have more time. We have more time to look into your history. We have more time to take a step back and assess all the different factors that could be contributing towards how you feel. We also get patients coming into us at various different stages. Some come to us because their period pains are increasingly bad. It's really impacting their lives a lot, or maybe they're bleeding a lot, they're anemic. Another subset of patients, and this is quite an important group, are those who are trying for babies and they find that either they're having multiple miscarriages or they're just not getting pregnant. And so these are some of the types of patients who might come to us. Depression can also feature as a presenting complaint. You know, they might come and they might go like, I just feel down, I don't feel a lot of joy in life, things don't feel great, I'm in pain half the month, I'm bleeding so much. So it could be all these things. And so when we look at it, because every patient can present differently, it's not a one size fits all. We have to look at each person and decide which is the strongest element that's causing all of this. And frequent, it's a few different ones that we have to address. So if it's your gut, if your gut is the main thing, we will have to look at your gut, we will have to look at your nutrition, get that optimized, and indirectly that will then improve your nutrient absorption. Your cells are able to work better. If your cells are able to work better, it's signaling in how it approaches things like insulin and other hormones improve. So insulin resistance, which is a very common feature in PMOS, is when the cells stop listening to your to the insulin anymore. They're like, you know what, you can keep yapping away, I'm not bothered, I'm not listening to you. And because of that, sugars are stuck in your bloodstream, and sugars being stuck in your bloodstream, a really bad thing, causes a ton of inflammation. So we are looking at all of that. We're then also looking at your hormones, and I'm not a fan of oral contraceptive pills, which is good for masking things and buying you some time until the rest of your body settles down and maybe your inflammation goes down. But in order to stop you from getting pregnant, it's a really, really high dose of an artificial hormone that's not identical to your body. What we prefer instead is bioidentical hormones to help balance it out if you need it. Not everyone may need it. Excess of testosterone, there are things that can be done about that. Insulin resistance, definitely can be things that can be done about that. Decreasing inflammation. So depending on what's causing your inflammation, there's a lot of different approaches to it, including LDN, low dose naltrexone. For those of you who are not familiar with it, this is something that you should absolutely research and look into. So multifactorial, every person is an individual. We need to take a step back. Stress could also be a big factor. And what do you want to achieve out of it? Do you want to achieve better quality of life? Are you looking to have a baby? All that will be taken into account as well. And based on that, we will design the right protocol for you.